Thank you, Mr. Chairman. Thank you, Mr. Secretary, for being here. In New York, every single hospital is reporting significant nursing shortages that they cannot fill. Over the last 3 years, contract labor has increased nationally over 250% and significantly in New York State as well. So many nurses across the country have left hospital-based positions and have gone to these traveling staffing agencies. It's understandable because the work is better, the scheduling is more flexible, but these agencies charge hospitals a significant markup to employ their nurses, leading some hospitals to accuse them of price gouging. The federal government pays a lot for health care, probably $1.6 trillion every year for Medicare, Medicaid, tax treatment, VA. It's a lot of money, but it's a lot of leverage. Is your agency aware of this problem, and are there efforts to address the shortage in a legitimate way without profiting significantly these agencies that employ traveling nurses?
Congressman, thank you for the question. And just as the state of New York is suffering through a workforce shortage, so are I know my state of California, and I suspect every member at this dais would say the same thing. We are making investments, and this budget does make investments that help expand workforce. It also helps provide states with the opportunity to train more people, whether nurses, doctors, child care workers. We want to increase the size of the workforce. One of the things that would help us increase the size of the workforce is if we get more women back into the workforce. We know that it's been very difficult. If you can't find child care, sometimes it keeps you from being able to go to work, whether you're the father or the mother. But principally, we know mothers have that prime responsibility more often than fathers do. And so we are working where we can. We did a grant proposal. That was, I think, last year, $103 million, where we put it out, and the recipients of the grant, we didn't put a lot of restrictions on it. What we said is, we want you to use it to try to retain some of your workforce, increase your workforce, or uptrain your workforce. And what we're trying to do is help keep folks in the healthcare profession.
Thank you, and I yield back.
The chair recognizes the gentleman from Oklahoma.